it's really exciting. This is my first Facebook Live, and I'm so excited that this Facebook Live is brought to you by Buds Baby. Okay, why Buds Baby? I really love Buds product. I've been using it for 5 years now. I've been recommending it to all the mummies and babies for 5 years now, and I have very good reviews about it. Now today we are going to talk about nipple pain and breast engorgement and how we can overcome it, right? Now keep your questions coming in. I'll be really happy to share with you depending on your own special situation. Now some of you may have situation that I can answer immediately. Some of you may need specialized attention, a special consultation. We'll let you know how to go about it later on, okay? So, okay, why is it that some mothers find breastfeeding tough? Right. Most of the time, I've been a breastfeeding consultant for the past 16 years, yeah. And I've met a lot of mothers, thousands of them, alright? And I've helped many of them, and in my opinion, I've actually, what I think and what I've discovered is that the more prepared a mother is during her pregnancy, the higher the chance are at being successful in breastfeeding. Knowing what to do, knowing what is normal, knowing what is not normal, knowing when to seek help, yeah? And the faster a mommy seek help, the better it's going to be as well, yeah? The higher the chances that it's going to be. For example, yesterday on T-Ban, somebody said that she's having breast pain, she's having nipple pain, like sharp knives just stabbing at her breast, and when the baby latches on, it's like this knife to choke into her breast, right? So usually these are signs that something is not right, okay? And we can't explain to you what is going on without seeing the baby, without seeing you directly. So it's a good idea to get in touch with a breastfeeding counselor for that. Okay. Now, one of the most common issues that most mothers have is nipple pain. Yeah. So when it comes to nipple pain, there are many factors. One is usually an incorrect latch when the baby latches onto the breast instead of latching onto the nipple. Onto the areola. Baby is latching onto the tip of the nipple. So baby's not fit like that to get an asymmetrical latch. All right. The baby is supposed to go open, darling, baby, open, this way. So the baby gets the whole areola in, right? But most of the time, mummies actually aim the breast to the center of the baby's mouth. So baby goes open, and they go and they suck on the nipple only. And if your baby is just sucking here, you will notice that you get a line across the nipple, and it's extremely painful, right? So first of all, you have to get the latch correct. Learn how to do it. There are many videos on YouTube, on the internet, and even at my class to teach you how to actually get an asymmetrical latch, and baby goes this way. Yeah. So what happens when you already have sore nipples? Poor thing, yeah. Sore nipples is really painful, and sometimes you may need to give it a rest. But while you're resting the nipple, usually it takes about 24 hours. Of course, if you apply something onto it, it will be helpful as well. Okay, the nipple will heal better. So what I usually teach mother to do is after latching your baby, all right. Observe your nipple. You see a line right in the middle of the nipple like this, you'll know that the latch is not good. Seek the help of a breastfeeding counselor. Otherwise, okay, to treat your nipples, you do use something it's called Epsom salt. You can get it from any organic shop. Epsom salt. Take 1 tablespoon and put it into a bottle like this. Okay, and put warm water inside. Yeah. Then you soak your nipple in this solution. Alright, you just soak when you're sitting in the toilet or it gets kind of messy. Okay, just soak your breast this way. You can just chew, and about 5 minutes. Now after 5 minutes, just let the air dry. Try not to use any towel or tissue on it, because tissue has small little particles, right? Just let the air dry very fast. You know, within 30 seconds, 1 minute, it's air dry. And then I would like you to use a little bit of your own breast milk first. Just massage and squeeze a little bit of breast milk. The milk that comes out, you dab, and let it dry. Yeah, and then you use some. I particularly like this nursing salve. It's from Buds nursing salve. It comes in a box like this, and it looks beautiful like this. Yeah. So you just squeeze out a small. I'm just gonna squeeze it out. This is the tester. Yeah? How much is this sell? I know this is really good. Don't keep it at home. Don't store it on the cupboard and not use it. All right, just use it. A dollop like this. Dollop like this. Can you see it? All right, and then you apply it all over the nipple. Can I? Okay, just all over the nipple, along the areola if you want to. Don't sayang lah. I know it's okay to use it. Okay, just use it. You bought it, you use it. All right. It's really helpful. It helps the nipple to heal. And after you have applied a generous amount all over the nipple, just let it be for a while. Don't wear your bra yet. If you have to go out, maybe you put on a breast protector. It protects your nipple. But otherwise, just go topless for a little while. Just let it air out. Just let it dry out. Then you wear your bra if you want to. Okay? And usually within 24 hours, we see your nipples healing properly. And the trick now is, once your nipple has healed, please get the latch correct again. I know sometimes it takes practice. You and your baby you're both new at this thing, you know. So you take practice, let your baby latch on correctly. If you can't do it, I can't stress this enough. Yeah, please get the help of somebody who knows, a trained, certified breastfeeding counselor or consultant who can help you. Yeah. Okay. So that's for sore nipples. Yeah. The next thing that usually most babies, most mothers experience is breast engorgement. Right? The second one, breast engorgement. What is breast engorgement? Breast engorgement is where there's a lot of milk in the breast and your breast is growing. All the milk is inside, it's not coming out. And because of that, it gets really painful. And sometimes some breast engorgement usually happens around the 3rd day, 4th day after delivery. Okay, can be caused by a few things. One of the main reasons for breast engorgement is that the baby is not latched on properly against the latch, right? The latch is so important. The baby is not latched on properly and therefore not removing milk well. Yeah, it's not removing the milk well out. So another reason for breast engorgement could be that the mommy has an IV drip during her delivery. She has an IV drip during usually a cesarean birth. And all this extra liquid is in her body, and it's all stored around her breast, and it causes a more severe engorgement. So we need to get it out, okay? So how do we usually I will recommend you to take. You can start taking it immediately after birth. Fennel seeds, F-E-N-N-E-L, fennel seeds. Or in Malay it's called jintan manis. You can get it from the local organic shop. You can get it from Tesco, Aeon, you know, all these places that sells spices. You can get it from there. But one of the most helpful way of helping the breast engorgement or relieving breast engorgement is of course breast massage. Okay, so there are a few techniques to doing your breast massage. I would say that there's so many videos on YouTube that you can learn from. To me, I think that there is no one special way. You just have to find out which one you prefer, just do it. And as long as you're giving the breast the tender, loving care that it needs, the milk comes out, you are on your way to a great breastfeeding experience. Now, when you're doing a breast massage, alright, you have to be very careful not to injure the skin. That's what most people do, yeah? They just massage their breast this way and whatever way, and then at the end of the day, they get skin burn. And the reason why it happens is because they are not using proper breast massage on. So here again, I really like this. I've been looking at this. I've been using this for the past 5 years. It's breast massage on. Okay, so all you have to do is, alright, pump up about 1 or 2 drops here. Alright, warm your hand with it. You don't really have to do too much. Your hand should be quite oily lah, huh? Alright, and then I'm just going to show you how to do it here. Alright, you have to remember you are doing it on your own breast. Okay, so since you are going to do it on your own breast, I'm just going to show you how it goes now. Okay, so this is me on my own breast, oil on my hand. Alright, I just rub it all over my breast. Just rub it all over. And then it really doesn't matter, there's no special technique. I can use a circular motion like this all over the breast, a circular motion, or I can use a knuckle and just rub it all over. I can just do it this way. I can concentrate on two breasts, I can do it together. So this is my hands, right? So this is my own breast. I'll do the butterfly stroke. Go down and up, down and up. Now as you're massaging yourself, you find that it's not smooth enough. It's okay. Just add on a bit more, a few more drops, and put it all down and up, down and up. Okay, and you can do circular motion to the breast and up again. All right, you can use 3 fingers, 4 fingers. All right, and we call this a small butterfly, and up, down and up. Okay, and you can go back the other way too, and come back the other way. And you can just do this one, this way, this way. Now this is if you are doing yourself. What about if your husband were to help you? Okay, yes, of course. Okay, tell your husband to be more gentle. All right, and if he can stand right behind you, put all on his hand, the same method. All right, the same method. He just pop his hand down and up, down and up, and you can just do this. All right, to your breast, and this way to your breast as well. Now, I'll teach you about 3 acupoints that can help the milk to flow out better and can also help the milk to increase. Alright, all of us have these acupoints, and one is directly underneath the armpit. Okay, so this is my armpit here. Yeah, so if I put all my hands here, this point here. Okay, and if I were to press on this point, it hurts a little bit. It's like ouch. It's not exactly very painful, but it hurts a little bit. This is the right point. So while you are watching TV or you are just doing things on your own, you can just massage it on your hand, on yourself. You can just use 2 hands to do it. So you just push 2 hands to it and massage, 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 massage. That's it. Okay, you can use the oil and do that massage as well. Or your husband could stand behind you and help you to massage both at the same time. Okay, then this is your nipple. Imagine that this is the nipple. Yeah, about 1 thumb line away from the base of your nipple, usually around here, is another massage point. So you just take 3 fingers and you just massage this point and press a little bit, massage, 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 and press a little bit. Okay, that's the next point. And then there's another point here. This is your nipple, about 6 fingers away from the nipple. There's a point here. Alright, so you can just massage here. And your husband can actually help you to massage this point. Gentle, circle, 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 press, circle, 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 press. So if it's on me, it will be 6 fingers away here. Alright, this is circle, 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 press, circle, 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 press. And then you continue with the butterfly, down and up, small butterfly, up again, and just this way. It really doesn't matter. If you forget all this, it's okay, as long as you just give massage to the breast. Massage the breast, but most very important is make sure you use good oil. Why? Because a lot of people, when they massage their own breast, yeah, they end up getting skin burn. Again, we don't want that to happen to you, yeah? Okay. So another thing that your husband can help you with is a back massage. Okay, this is your spine here. Alright, and you sit in a chair. If you can see me properly, you sit in a chair and you lean over the chair like this. Okay, and then just use the thumb, ask your husband to use the thumb and massage it in circular motion, just like that. Circular. Or you can use your knuckles and massage. Massage. Okay. If you're wondering where we are now in Gina's place, and of course we have babies here and we are hearing a baby crying, yeah? Baby is ready for feeding now. Okay, so circle, 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 circle all the way down. I can just go down, 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 and then go towards the breast and massage and go in circular motion. So this is how it looks like. Go down towards the breast and circle, circle, circle. Even this point here, yeah, this point here, you should use a breast massage oil to do it. Okay, do not do it without oil because you might get skin burn if you do it without any oil. Alright? So, well, shall we see if we have any questions? Are you okay with that?
No questions so far.
No questions so far. That was really quick. I've used up my time, have I? Or can we stay on a little bit more just to get questions?
Yep.
Yeah? Okay. I was given 15 minutes. I didn't realize again. We have been talking so long.
You're quite on time.
Yes. Okay, so while we are looking for the questions, where can you get this? Yeah, you can get this from Buds website, from their store. You can shop it from their store, and it's at the link is on the screen here. Okay. It's in my confinement center. Of course, we take care of a lot of babies. We take care of a lot of mummies who have breastfeeding issues. And honestly, I've tried many brands, and I've tried so many different nipple cream, nipple salve, and other stuff. I personally prefer to use Buds. Yeah, and there's a reason for it, because I trust the quality, and I trust that there's no nasties inside. Yeah, I've been assured of that, and I've read the papers. I've actually read the reviews. I've actually searched into what they put inside here. This is so safe that once you put it onto the nipple, okay, for the next feeding, you don't even have to wipe it off. Alright, your baby can immediately latch on, and that's what we tell mothers. It's the same thing with the breast massage oil. Once you massage your breast with it, you don't even have to wipe off. And when you continuously massage your breast with the oil, it actually absorbs into the skin, giving you smooth skin, healthy breast, and you won't find that it's very oily at all. Okay? And you don't even have to wash it off when breastfeeding your baby. Hi Carly, you have trouble latching and your baby is 13 days old, yeah? If after delivery, have you been direct latching all the time? And in the hospital as well. So your baby is only 13 days old, and how have you been feeding your baby? Are you giving the baby a bottle? If you are giving your baby a bottle, it becomes a little bit more difficult for the baby to learn how to latch onto the breast. So my suggestion for you is you need help for somebody to help you carry the baby, position your baby, and help you to latch the baby on. Now sometimes some babies, thankfully not all, some babies once they have been on a bottle, they may refuse the breast totally. But I've known of many cases, many mothers who are very determined. They get help immediately, get the help of a breastfeeding counselor, or get the help of a lactation nurse in your hospital to see if you could actually latch on the baby. Now, or I'm not sure where you're staying. If you're staying somewhere that is too far away, perhaps you could log on to Google, go to YouTube, and watch videos on how babies are latched on. Okay, but I think the most helpful for you would be to get the help of a lactation consultant or a breastfeeding counselor to help you position the baby and latch on the baby. It's still very possible. Your baby is only 13 days old. There's a lot of things that you can still do. Yeah, don't wait too long. If you can, get help immediately, like now. Okay, you have been feeding your baby by bottle and you come for each feeding. So I'm assuming that since you are here watching this video, you really want to breastfeed, right? I'm sure of that. So if in order to succeed in this breastfeeding journey, yeah, this time you have to stop the bottle. Really, stop the bottle. You feed your baby using a cup or a spoon, yeah, and get the help of somebody who knows how to help you to latch onto the baby. Okay, there's a link on TBAN, the Breastfeeding Advocates Network. There's a link there on breastfeeding counselors. They may be able to go to your house and help you depending on where you stay. Now, if nobody can help you in the next 24 hours, maybe you can come and see me. I'm in Gina's place. I'm in Taman Yau KL. Yeah. Okay. Oh, we have met 3 lactationists. But for 19 days old, yeah, 13 days old, I think you could still get proper help. I'm not sure who you got the help from. There might be other underlying issues. It's okay, come and see me. Yeah.
We have a question from Wan Ting. She said, may I know if the massage is to increase milk supply or just to relieve engorgement?
Both. Alright. First, in the initial days, it's to relieve the engorgement. Alright. And at the same time of relieving the engorgement, you send a signal to your brain to actually produce more milk as well. So it's both ways. Yeah. After the engorgement has been relieved with good latching, the baby is able to remove milk well from the breast. Yeah. The continuous massage actually helps to prepare your breast, help to stimulate your breast for further milk production and continuous milk removal. So it's both dual benefits for it. I've known some mothers who after 2-3 days they stop massaging their breast when the engorgement goes away, you know. And I think you should continue. You should continue to massage your breast for as long as you're breastfeeding. I also know some mothers, they continue to massage their breast even after breastfeeding to keep the shape of the breast, to keep the breast looking healthy. I do it actually. Yeah, continue. I actually massage my breast at least once a week while I'm bathing, just to make sure that all the lymph nodes and all is lymphatic drainage massage as well. You can do it. You can Google and find out how to do it yourself. So that who says that breastfeeding mothers will end up with saggy breasts? It's not true, yeah. Okay, so you can do a lot to keep your breast firm after breastfeeding. Yeah.
Okay. Chombi Katie also asked, can I start massaging during the 3rd trimester?
Okay, this is a tricky one. You can start massaging in the 3rd trimester, usually after 37 weeks. Yeah. If provided that you have a healthy pregnancy and there's no threat to your pregnancy and there's no threat of early labor. Okay. So for some mothers, they're already planning to have a cesarean. It's a planned cesarean, and maybe at 38 weeks, 39 weeks, I'm not sure. If you already plan to have a cesarean when you're pregnant at 37 weeks, you can start massaging your breast. Okay, the same method that I've shown you just now. And in fact, you can actually see if you can squeeze out a little bit of milk to get the milk kicking in, to get the milk. Some mothers can actually squeeze out and express quite a lot of milk, and they will keep it in a syringe. Alright, and then they will bring it to the hospital to be fed to the baby instead of giving formula milk in the hospital. And it's an entire new topic, entire big topic about why you shouldn't be giving formula milk in the hospital, okay? And why you should trust your body. You know that you have a lot of milk, okay? So yes, you can massage your breast starting from 37 weeks onwards. The gentle massage just to get it stimulated. But at any time you feel contractions or serious contraction that's different from Braxton Hicks, yeah, you know about Braxton Hicks, you should stop. Okay?
Okay. We also have from Giovanni's Lee. She asked whether does it need to be Epsom salt in particular?
Yeah, it is. Epsom salt is magnesium sulfide. Magnesium sulfide has it actually draws out it draws out excess liquid from your body. Plus, Epsom salt soothes just now I asked you to use Epsom salt for sore nipples, right? It actually soothes and sterilize, kills bacteria on the nipple. Okay, Epsom salt does it work with sea salt? Does it work with table salt? Yeah, it does, but Epsom salt works the best. Another benefit of Epsom salt, yeah, this is Epsom salt, yeah, can get it. Epsom salt is when you are putting it to your nipple like that, it actually helps to draw excess liquid that causes the engorgement in your breast as well. So Epsom salt is it, yeah. Another thing about Epsom salt while you have breast engorgement is you can put this Epsom salt 3 tablespoons into a pail of water, warm water, and while you're on the toilet, you sit at the toilet, you soak your legs in it. It actually draws out the excess liquid. So people who have swollen ankles, who have water retention, the Epsom salt will work very well for you.
Okay. Any more questions?
Yeah. It's been really fun to do this with you. I wish to do more of this with you. This is my first FB Live. I wish to do more. And if you feel that this video has helped you a lot, please do share it with your friends and send in messages. You can send it to Buds, okay, send it to me, okay, on what are the topics you would like us to cover next. Yeah, breastfeeding is such a huge topic, so actually many things that we could cover on.
Okay, we have a question from Diana. She said that you mentioned fennel seeds at the beginning. So could you share more on how to consume it?
Okay. Fennel seeds you can buy from organic shops, right? It comes usually loose seeds. I don't have one to show you now. It comes in loose seeds. You take 3 teaspoons plain water. Don't chew it. Don't have to put it into a tea. Don't have to put it in hot water. Just swallow it straight. Okay, 3 teaspoons, 3 times a day. Yeah, it will really help the milk to flow out.
Okay. So. Oh, you already have someone that wants to meet you. Kalai.
Okay, Mommy Kalai will really like to meet you. Perhaps you can drop me a message on my Facebook page. My Facebook page is Gina Yong, Breastfeeding Counselor. Okay, just drop me a message and I will give you instructions on how we could meet. Yeah, or I could give you a link to all the other breastfeeding counselors that could help you depending on where you stay. Yeah. Okay. So we will have to I would love to continue talking. You know that I love talking. I love to continue talking, but we know it's not possible. Okay, so we have to end it here. I hope to see you all again. It's great to see you, and do send in your messages, do send in your requests for any topics that you'd like us to cover in future. I'm not sure how often I'll be able to do this, but it depends on your response. Yeah. So thank you very much. I'd like to take this opportunity to thank Buds for the support that you've given us in doing this Facebook Live with us. Yeah, thank you, Buds.
Thank you.